Welcome to St. Petersburg Together. I'm your host, Janis Ford. A healthy community is a happy community. One group trying to make sure everyone takes ownership of their own health is St. Petersburg's Healthy Start federal project. With the help of the C.R.E.E.D Consortium, this group is trying to mobilize the community to create a safer, healthier environment. Joining us today to talk about the Healthy Start project is Tellis, Consortium Coordinator from All Children's Hospital, and Octavia Teharte, a member of the C.R.E.E.D group. Thanks for joining us, ladies.
Thank you for having us.
First of all, let's talk about C.R.E.E.D. I know that's an acronym, so tell us what that stands for.
C.R.E.E.D stands for Creating Racial Equality and Ending Disparities. We specialize in trying to reduce the birth outcomes here in St. Petersburg and the community and infant mortality.
Right. I know that the Healthy Start project has been around for quite some time. And do you know the year that the Healthy Start first came here?
Well, it was over 15 years ago that the program has started. We've gone through some name changes and we've done quite a few things to enhance and to basically continue to advance and reinvent ourselves over the years. But it's been around for 15 years as part of the initiative.
I know that we were, this was a welcome project to our community because there has been a lot of issues with infant mortality rate, especially in the African American community. So that was kind of like a welcome program to come and try and address those issues in our community. So tell us, what is the mission of C.R.E.E.D?
Well, I'll say C.R.E.E.D actually works more with the community as far as Healthy Start. Federal works more with women, children, but we welcome anyone that's, willing and able and care enough to make a difference in the community. So like you said, our primary mission is to work with women prior to pregnancy to make sure they have healthy babies before they decide to have those babies.
Okay.
So that's what we do.
Okay, so how do you get your clientele?
Actually, All Children's in the Health Department actually work together. As you know, it's a free clinic, and some of the young ladies come in, they receive the free pregnancy test, and if they come back negative, they're actually referred to the program.
Okay.
So that's how we get most of our clientele.
Okay, you said if the pregnancy tests come back
Negative.
Negative.
Yes, that's why I say we work with women prior to
pregnancy. Okay. I'm like, negative? So, and if they come in and they're already pregnant, and this may not be their first child, but they did not follow, healthy habits with their first, second, or third child, and then they come to, the health department, and you'll try to educate them about what are the healthy choices that they need to make in order to have a healthy baby.
Right.
Yes.
Do you have any statistics as far as infant mortality and?
Just to push out rates, I will say that for every one white infant, there are 3 black infant deaths.
Wow.
So that's the infant mortality rate in South St. Petersburg is actually, I want to say 6.3. Wow. It has decreased over the years, but we still have some work to do.
Wow, that is that's tragic. It really is. That's really tragic. And those deaths, are those as a result of women not taking care of themselves, not doing vitamins and eating properly and stuff like that? It's not necessarily that they are having drug issues or anything like that, or is it? It's
a number of things.
The research have shown and proven through this program that the women who have experienced the infant mortality, they found that they have been the ones that prior even to them becoming pregnant, they have all experienced some racial inequality, injustice all the way across the board in almost every area. So they found that that is one of the factors, which is why this program was created, to try to address these factors holistically.
Okay. So tell us about the consortium and what exactly do you all?
Well, we're actually a group of individuals, family members, grandparents, what have you. We come together quarterly, and we just think of creative ways to get out in the community just to promote health awareness, just community involvement, period. And some of the things that we do, we have free family movie nights. We have activities throughout the year, annual infant mortality walk to, honor and acknowledge that holiday. So we have a couple of activities. I'm kind of in the air a little right now, but we have a lot going on as far as C.R.E.E.D.
Now, do you all, and I'm not sure, but wasn't you all at Family Fun Day too? Didn't you set up a booth and
Yes.
disseminate information that way? So you are also involved in those type of events too.
Yes.
So you try to get out there and disseminate information at events that,
Yes.
that you can do that.
Part of the community action group, we encourage community involvement and advocacy and education. Part of our program, we provide training, we participate in many other organizations, we give resource. One of our primary goals is to give input to the St. Petersburg Healthy Project federal program to basically help them understand and know the resources that are needed for these women who have experienced or may possibly experience infant mortality.
So you'll basically give them the tools that they need in order to work better with a family in the
Yes.
community and how to go about assisting them. What's the best avenue in order to do that?
Right.
Yes.
And what better way to do that is to ask the community.
Okay. So on your consortium, this is made up of community residents, and those could be mothers too that may have had the opportunity to work with you all. And so, what better advocates can you have?
Yes, yes, yes.
That-
And even the fathers, we include the fathers in the programs.
Well, that's great. Now, give me some information for our audience listening out there, and I know that we have some things that we are going to put up on our screen, and as far as contact and things like that. But you all do have a website, and what is that website?
It's actually a part of the allkids.org website. You would just put www.allkids.org/healthystart.
Okay.
And we also have a Facebook, which is our main avenue for media. We have Ask the Health Educator series where we actually post anything as far as healthy eating habits to exercising daily, anything that might be helpful when it comes to healthy habits.
Okay.
And we post these things on the website, any upcoming activities, any helpful information we try to get out there.
Okay. What, if I wanted to be a part of that consortium, what do I do? Who do I contact?
You just come.
Just
Contact me, any one of the members, anyone's helpful, but basically we just ask anyone with the mind and the drive to actually work, because it's hard work, it's hard to change people's perceptions.
Exactly.
So
That's an ongoing job.
so anyone, you can just come and just gain the information, gain some insight, just join in and see what you like doing.
Now, where do you hold your meetings?
We actually host them at the All Children's Education and Conference Center.
Oh, okay. It's a long time since I've been over
Yeah,
there.
it's 701 4th Street South, and one of the numbers that they can also call is 727-767-7680, and we meet quarterly, February, May, August, and November.
Okay. Whenever do you all go out into the community, how do you approach these? That too is kind of a very
Yes.
It is.
Thank you for asking.
Personal.
We actually canvas. We call that community canvassing, and it's basically where myself and the members get together. We go out in jeans and sneakers and T-shirts, and we look like regular, normal people. And we'll approach everyone and say, "Hi, you have a moment? Can I speak with you? You know what's going on in your community? Infant mortality. Do you know what that means?" And we share the information as they receive it. And we have those who may not receive the information, but as long as we're trying to get it out there, and we tell one person, that one person tells two other people, and so on. So that we do that often.
So, why address racism and racial equality?
Why is that the primary focus? Well, in our acronym, Creating Racial Equality, it has been found that racism actually has a direct effect on health. So the best example I can give is a white college high school dropout compared to a African American educated married woman. She actually has a worse birth outcome. And it has been found that, you know, there's no other, with lack of a better word, effects on her that cause her to not actually have these unhealthy birth outcomes, but just stress. Cortisol levels up, and it actually causes stress on the body, which causes stress on the baby, and it's like a domino effect. So
that's very interesting. So when you have, you know, the pregnancy rate among teenagers, you know, I was in the social services field, and that was one of the big issues with pregnancy with youth. And do you see more of that mortality rate among those young births?
I would say no. I will say that the teen rates have decreased, but we work with women in their birthing ages, which is 14 through 45, and it doesn't matter the age at all. It doesn't.
But the circumstances surrounding, I guess it's a case by case that you have to address the issues. Do you feel that when you have clients, are they pretty forthcoming about their situations?
In most cases, yes.
They
and
are.
in some we have to work with a little harder, but yes. Most
Kind of
likely
like
they come out.
pull the information that you need in order to make an assessment on each client.
Well, that's why it's important that we have community people involved, because you have to have the trust of the people in the community to relate. And it's one thing to sympathize, it's another to empathize.
Right.
So that's one of the things that we have going. You know, I too was a client at first, and now I'm a member.
Okay.
And so we can relate to the issues and, you know, basically understand how to address them and to be sympathetic and respectful towards them.
So how many do you have in your consortium? Is there
It varies,
it
but
varies.
we have up to 40 individuals, and you know, you can participate not only in the meetings. You can actually contact me and let me know what your input is, what you might have as a suggestion for the program. You know, we have some people that actually stay in Ruskin, you know,
really?
in Tampa, but they still participate via email, conference
Okay.
call,
All
what
right.
have you.
Oh, okay. So you don't necessarily have to be located here. You can still be a member if you're in Bradenton or what have you.
Yes.
But do other counties have similar programs like this? If the Healthy Start program, is that something that's all over, or
Yes, it actually is.
didn't that start in Hawaii or something like that? I'm trying to remember
Hawaii is
back.
one of the places.
Yes.
that
Right.
they have.
I think that when this initiative first
Yes.
started, it was like it started in Hawaii. I do believe, if my memory serves me right, it's been quite a
Yeah, it
while,
has.
because I worked in the social services field for about 20 years, and basically working with young teen mothers and their babies. So, you know, that's how I got involved with that Healthy Start project, and that's why I say that it's been around for quite
Yes.
some time. And it's a wonderful project. I think that it's well worth needed, because you have so many people who are dealing with these type of issues.
Right.
Also, it's a very great idea to have the community involved, because like you say, you know, that trust, you know, and some people you can't approach. And it is always better to have someone who lives in the community, who is working with you, and they may be able to approach someone, whereas you all may not be able to do that. And I know that sometimes people have this issue with revealing personal
Right.
issues. So do you come up against that a lot?
Sometimes, like Ms. Octavia said, it's definitely important that we empathize with the people and that they trust us, and we show that we care and that we support whatever the situation may be. You know, whether they make some bad choices, we all do.
Yes,
so
we do.
we learn from them, and it's just, you know, important for us to educate them for those bad choices they may make. So.
And we've conducted focus groups too as well, and we ask. It's nothing better than get it from the horse's mouth.
That's true.
What is that you want and need, you know, from them, and we try to accommodate and work around that within. And so far as
So I know that we kind of talked about a lot of things, but you have specific goals that you have put in place. Can you talk about those?
Our primary goal is basically reduce these infant mortality rates.
That's number one.
Specifically, yes, in South St. Petersburg. I'm not sure if we said, but the highest instances of the infant mortality occurs in 33705, 11, 12, and 13.
Wow.
And most of these places are in South St. Pete.
Yes, that's Midtown.
yes,
That's basically our primary goal. Our second is to just gain community support. We just need more community support just for everyone to kind of see and get involved. That's really what our goals are.
Okay. What about your funding?
Funding? Well,
Is that an issue? Are you always
Well,
looking for funding?
we're always fighting for funding,
Oh,
and that's
yes.
a part of the consortium too. The
Yes.
members have an opportunity to go to Washington and speak
Oh,
with the
okay.
senators and urge them to reauthorize the grant. I've had the honor of going one time myself, and I know Amber has gone this year, and we go and we take representatives such as myself that originally started the program, and we say, you know, this is a face with a name. The program works. This is
Right.
what has happened, what we do. And we've been blessed so far. We get creative each time, but yes, funding
You
is,
have to do that.
yeah, it's always a fight. You know, unfortunately, it's always a fight. But
Right, because there's so many other programs that's out there, and they're fighting for the same funding.
Yes.
And so, you know, that has come in, you know, increasingly harder to get out there and get funds.
Yes.
But I know that collaboration is a big part of any agency. You know, it's very important that you collaborate with other agencies, have like you are with the Healthy Start, you know, federal program, and look what's happened out of that. You know, that you. So, what else would you all like to talk about as far as what you're doing in the community? What information do you want to get out there?
I just wanted to add to the last discussion question was we're actually working on becoming a 501c3
Oh,
or a
okay.
nonprofit so we can do more in the community. But what we want people to know is that, you know, it's important for us to take ownership of our well-being. And, you know, only we know what we need. And we want, you know, the community to come to the table and to voice those things that we need. Anything, whatever it may be, we just want everyone to voice their concerns because your voice is important.
Yes, it is.
Yeah, so.
Well, I'd like to add for sure that we're very diligent about trainings. We just finished a community worker health workshop where the women were able to come and get training for 2 Saturdays all day about how to work in the community. And these are certificates that they can also use to go into employment other places. We also do a lot of women empowerment. We have a particular empowerment series, what we call the Swans, where we do different women topics, and we have people come in from the community that talk about subjects from healthy foods to healthy relationships. We address everything holistically because we realize that this process is a life course module, which basically means everything addressed. It's not just a matter of just carrying the baby, it's the financial, it's the emotional, it's the mental, and the spiritual. And how we do that is by including other organizations that provide those services, and
That's
we
that
bring
collaboration
them on.
piece.
Collaboration.
It's very important because no
very
one
key.
agent can do everything.
Very key. So the opportunities are there, you know, very much so that for the women to grow, you know, education all the time, and they get the network, they meet people, so many experiences that they probably would not have gotten, you know, by just sitting in the living room.
Exactly.
So we are more than just, we don't just meet to meet, you know, we are a holistic program that works and that serves in all the areas for women and the family, even the men and the children. You know, like she said, there's several things that we do. So,
You know, because I truly believe that, you know, when you're educating someone about different issues, that it's always very important to do the whole family. You have to
Yes.
educate the whole family because that's your support system. And
Definitely.
they're there in the home. So, you know, if that's happening, I think that you have more of a success rate because
Yes.
you've got that support in your home so that, you know, and even with you know, folks who are dealing with, you know, drug problems and things like that. You know, it affects everybody in the house. So everybody should be getting that education or that counseling or what have you, and for it all to work and be supportive. Give me contact information again. Let's talk about the contact information. If someone wants to get involved with the consortium, or if someone, an expectant mother wants to get some help, who do they contact? What's the number?
Our primary contact number is 727-824-6963, and that's actually a health department phone number where you contact in. If you would like to receive services, they'll be able to help you. As far as the consortium, 727-767-4731, and that is myself. Just give me a call and I'll be more than happy to share the information.
Okay, and the websites, if folks want to find out more information, review what we've all talked about here today, what is that?
www.allkids.org/healthy-start.
Okay, so you're located down at All Children's, is that correct? And your office is located?
All children.
All Children's as well. And how long have you ladies been involved with this program?
Miss Octavia definitely has
9 years. Yes, I've had my daughters graduate through the program, and like I said, I came in as a client and also became a contractor with the program, and that's why I'm saying it's important for the women to know the opportunities that were there. And I've had a lot of firsts in the program. The program has been very essential to my growth and involvement. So
you came in as a client, and
yes,
now you're...
I was an at-risk client, high blood pressure, and I had experienced a miscarriage myself. And I was looking for a program that would address things holistically, not just me, but the kids. And, you know, it fit very well. And I came in and I took advantage of a lot of opportunities, and I continue to stay.
Oh, okay. So you are a living, breathing poster child for this organization.
I like to consider that, yes. I love it. It's been grand, you know.
And I've been with the program for a little under 3 years now.
Okay.
So I've definitely learned a lot from Miss Octavia.
And you continue to teach, and now you're passing on your knowledge.
No, Amber's an asset. We're really, really good about bringing people, and it's always refreshing to have youth, you know, in the season. We need it all, you know, and that's why we're so open to the community. You know, you don't even have to have someone in your family that has a baby. We need it all. So we really welcome the entire community. That basically anyone that has an interest in eliminating the disparities.
Yes.
Okay. So you also, for folk out there watching who are having events, then they need to contact you so you guys can set up a booth, and so you can disseminate your information to do as much education as possible.
Yes.
So there is an event that's coming up. I know that I do a lot of community events. And I certainly, you know, I know that you all have been participating in Family Fun Day for a long time, and we always enjoy for you to come out and share and educate the community. So Back to School Care Fest is another event that's coming up. Have you all had any contact with those?
Yes.
Okay, so you will be setting up there at that event as well?
Yes, we'll actually be with Junior League and actually with the People That Love Mission in church.
Okay.
And those are the two we do annually.
Okay.
Each year.
There's another one too that you may be interested in, and that's the African American Health Forum that they usually hold on at Johnny Ruth Clark, and that's usually in November. I know the Back to School Care Fest is also usually held at Johnny Ruth Clark, but since St. Pete College is going to be breaking ground and doing their construction for the new building, that has been located to the Davis Center for the Back to School Care Fest this year. And I have to find out, because I do help plan, well, I am the city's liaison for those two events, and so I have to talk to Dr. Bryan and those about the African American Health Forum, where that's going to be this year. So that too may be relocated as well. You know.
We would love to have that conversation.
Great. Well, thank you, ladies. And thank you again for joining us. And, of course, here's the contact information for the St. Petersburg Healthy Start Federal Program. I'm Janis Ford. Thanks for watching St. Petersburg Together. See you again next time.